Natrocell.com. I'm Bill Carlson, the founder of Natrocell. As a homeopathic practitioner for the last 25 years, I've seen many scabies outbreaks all over the world, but none more than right here in the United States. It's literally an epidemic, and it's very concerning. Over the last 10 years of having Natrocell, we've gotten literally hundreds of emails and phone calls on how to test for scabies and what the best ways are to use our products to maximize the results. So very quickly, I'm going to show you how to do a scabies ink test. It's very simple. You're going to just need a few things. First of all, you're going to need some mineral oil. You can get this from your local pharmacy. You may actually have some already at home. You're going to want some washable ink pad available at any office supply store. I prefer washable ink because it's just easier to get off the skin. You can use permanent ink pad, but it's my experience that it stains the scabies darker in color and it makes it more permanent there once the oil mixes with it. So I prefer washable if you can at all get it. The next thing will be that you'll need some glass slides. These glass slides are available. You can get them online, but sometimes when you purchase a microscope, which we're going to talk about next, they do come with it, especially the little bit more expensive microscopes. You'll need some glass slide covers. These glass slide covers are also come with a microscope that you can either order online or go get at a hobby shop or toy store. Next week, we'll talk about the microscope. We have available online at Natrocell.com our own mini microscope here. You can get these at a hobby store. It's possible you get them online, but the big thing is to make sure that it's 30 to 40x power microscope and that it has a built-in LED light to it, because that's crucial to being able to identify the mites under a microscope using this product. The other type of microscope is a traditional compound microscope. This is one here that we have in our Nature's Innovation Lab that is a typical compound one, but the difference is that this hooks up by USB to a TV monitor. That's not really necessary for you. You can get these online on Amazon, those kind of places, for $90 to $300 depending on how much you want to spend. Again, just make sure that it has at least 30 to 40x power magnification. And then lastly, we're going to want to use a cotton swab. These are sterile cotton swabs that we use here in our FDA lab, but certainly sterile is not required. You can use just a regular Q-tip. So let's get started. Quickly, you're going to line up your slide here, and then you're going to take your, we're going to prefer to use blue. The reason we use blue, the washable ink, is we usually use a stain here in the lab. I'm sure you can remember from biology class called lactophenol blue. We could use that here, but I'm just as good, and I like it better because it's a little bit more washable. It's also, the toxicity is probably a little bit less as well. Here I'm going to basically soak this cotton swab, and then I'm going to take and on any lesion or pinpoint dot there that you have of a scabies bite, you're basically going to rub this, put a little pressure behind it, rub it into the lesion there, and you will see that your skin's turning blue. You may dip it again here. Then I'm going to let that dry for a second. Next, I am going to take some mineral oil, and very simply, we're going to use a sterile swab here, and I'm going to apply these dots onto the lesion here. You don't want to use too much, but you do want it to get wet. Next, we're going to take our glass slide, and we're actually going to do the actual skin scraping. Now, this could be done with a scalpel, anything like that, but for me, this is just as good. And if you see now the blue oil, and that is on there, I'm going to take a pipette. You could take a knife or scalpel, anything, and move it a little bit more to the center, away from the edge there. Next, we're going to carefully take our glass slide cover, and be sure not to get fingerprints on these, and go ahead and drop it on there. I'm going to tap that down. You can do this without a slide cover. Just understand, when you're looking through the microscope, you're going to be seeing layers upon layers, and it's just easier. This actually mats it down so you can see it better. And then we're going to take our mini microscope here and peer through, and you can really start to see, mostly of course because I do not have scabies, I'm seeing skin cells here that were scraped from my skin. But I'm going to be looking for the scabies themselves, which you can take a look on Google Images. I've also posted some on this blog here, and just type in scabies pictures or scabies microscope, and you will see literally hundreds of pictures there. I'm going to be looking for the mites themselves, their eggs, and then you're going to also see dead skin cells and possibly a little bit of blood under there. You can just as easily take this slide and put it under a traditional compound microscope and take a look here. It's the same procedure. What we're looking for is the same thing. Scabies mites, eggs, fecal matter from the scabies, as well as dead skin. And that's pretty much how you can do it. You can, if you want to wash this off your skin, use some what we call IPA here. This is a technical grade, but isopropyl alcohol, obviously you probably have that in your sink cabinet available right away. If you do find out that you have scabies, I think one of the reasons that we wanted to show this to you is because we get so many calls is people don't know if they have scabies, and it can take 30 to 45 days to get in to see a dermatologist. And for me, right here in Atlanta, that's very typical. If you don't want to wait that long to get your diagnosis, so sometimes people, will resort to doing this, and I think there's nothing wrong with it. I definitely support the medical community and stand behind them. Most of our customers over the last 10 years, really, for our products have come from folks that have used traditional medicines out there, things like permethrin and lindane and that kind of thing, that the doctor will prescribe. There's nothing wrong with them prescribing it. Just know that these are harsh pesticides, that they can cause carcinogens and a number of different problems. But I think the bigger problem here is that, here in the medical community, it's not really discussed a whole lot, is scabies have become resistant to any kind of traditional medical pesticides like permethrin. And what's happened is the scabies have become resistant and they've mutated. And so, for instance, if you treat, and we've had a number of customers tell us this over the years, they'll treat, it'll knock them back for a little bit, and then they come back, they're twice as strong, and it just doesn't work. And that's how, with our natural products, we've been able to help out a lot of people. I'm going to tell you real quick about our products. This is our scabies bath soak. You basically put in 20 to 30 drops into a hot tub of water and lay in it and soak for about 10 or 15 minutes. It's going to help open up the pores. These medical grade essential oils are lipophilic. They soak into the skin. They help open up the pores there and allow the next step to really get in and help relieve the itch with the mite and actually get rid of the problem. This is our Scabies Relief Soap. It is an FDA registered homeopathic medicine. You basically scrub up with this and let it stay on your skin for at least 5 minutes, and then you can wash it off. You're going to do this a couple times a day during this program regimen. And then once you get out, you're going to pat yourself dry, and you're going to use the Scabies Topical Cream, which you will apply all over your body from head to toe. And then you're going to leave that on for 12 to 24 hours, rinse off, and repeat this process for 3 or 4 days. And we're going to ask you to take a break for 3 or 4 days because these mites have life cycles, and then repeat this again for 4 or 5 days. And it may be necessary to do it again in 4 or 5 days. You'll know, as you can tell, as the itching starts to stop. We've been able to help a lot of people here with our products. We think the environment is very, very important, so your hygiene is really important in treating scabies mites. So we have a hospital-grade viricide, disinfectant fungicide product that is used in hospitals. It's very potent, and it's very effective at cleaning, your areas that you might have scabies mites left around. So your office seats, your office chairs, your bedding, couches, that kind of thing, anywhere that you're touching, because you want to avoid contact with anyone to prevent scabies infection from moving out. And then a more natural solution that we have is our natural all-purpose enzyme cleaner. This is a concentrate. You mix it with 24 to 48 ounces of water, 2 or 3 ounces to it, and then spray that on the areas the same way. This is a natural alternative because, being a homeopath, we certainly encourage that. We have the stronger products because we've been asked by people, hey, what stronger can I use? What product is EPA registered to be a fungicide, viricide, that kind of thing? And the Benzarid is an EPA registered product. Well, thank you very much today for allowing me to share with you the Scabies Ink test as well as our products. And we wish you health, wellness, and happiness. You can email us at info@natrasil.com. You can go to natrasil.com and send us comments or emails. Leave us comments here on this video blog. And again, we wish you health and wellness as you go forward. Take care.